hand corner. All right, great. So again, thank you all for coming to our webinar today. I'm Gailey Wamasa, Chair of the VA section of Division 18 of the American Psychological Association. Really excited to bring to you today very timely webinar about some wonderful resources that we have available. Not just in VA or for veterans, but really for anybody who would find them to be helpful. So today's talk is free, discreet, accessible VA's mental health apps in care. And Tim, before we get started, do you want to just do your little blurb again with the QR code? Oops, sorry.
Sure, I'll let Colleen introduce herself here in a moment. For those just joining, if you like, you could take your device and aim the camera at the square code in the middle of the screen, the QR code. It'll take you where to download COVID Coach to follow along. Colleen will be walking us through the app later, and it might help for you to have it on your own device to play around with it. So please take the time to do that now if you haven't.
That's very cool. And while you're doing that, I'll go ahead and introduce our fabulous speakers today. First up is Dr. Colleen Becket-Davenport. She's a clinical psychologist and a GIF mobile mental health app facilitator with our National Center for PTSD Dissemination and Training Division. Prior to joining the National Center, Dr. Becket-Davenport was an instructor of psychology in the psychiatry department at Weill Cornell Medical College, where she contributed to PTSD clinical research in the program for anxiety and traumatic stress studies. During her time at Weill Cornell, she also served as a primary clinician in New York Presbyterian's Military Family Wellness Center. And she's worked with veterans from all branches and service eras with a focus on evidence-based treatment for PTSD and comorbid conditions. And joining her today is Dr. Timothy Avery, who's also a clinical psychologist and also works for the GIF mobile mental health app facilitator with the National Center for PTSD Dissemination and Training Division. He provides psychotherapy in addition to supporting VA app implementation facilitation. As a management consultant prior to his transition to clinical psychology, he facilitated systems implementation through communications management and business process standardization for multiple federal departments. And if you understood that, wow, you have earned your CEU for the day. He's also a U.S. Navy and OIF veteran. Thank you so much for your service, Dr. Avery, and provides mindfulness training and interventions to veterans and healthcare professionals through 2 nonprofits. Just a second before we get started, I know many of you want to ensure that you'll get your CE credit. Everyone who is registered for this webinar will automatically receive a link via the email address that you used to register for this event. And that email will have a link to a SurveyMonkey questionnaire. And once you complete that survey and submit it, you will receive your CEU in approximately 1 week. And I will post something to that effect in the chat toward the end of the webinar. And on that note, if you want to take it away, Dr. Becket-Davenport.
Thanks so much. I'm actually going to let Tim get us started here.
All right. So go to the next slide. Thanks for that great intro. As I mentioned, or you heard, I'm a veteran there, and I also enjoy talking about these tools because as a veteran and mental health provider, there's settings that I might want to bring up mental health, but maybe it's a group of people who weren't as interested or engaged as I am in mental health care, and apps are a good way to kick off the conversation. So excited to share these tools with you today. And before we get started, we'd like to acknowledge that Colleen and I are presenting from the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the SF Peninsula. Wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush community, and by affirming their rights as First Peoples. Next slide. Here are our objectives for today. We're going to talk about some common features of VA's mobile mental health apps, talk about how to incorporate them into the continuum of care, and then more specifically, how you engage specifically in an episode of care and utilizing these tools. Next slide.
All right.
There we go. We are part of a larger team. They're pictured here. And you've heard, you may not be familiar with the word or phrase JIF, or Joint Incentive Fund. It's congressional funding for VA and DoD to engage in initiatives that will ultimately be self-sustaining that improve access to care. So it's a parallel DoD team working on this effort as well and sharing these tools. We're representing these great people here. Next slide, please. And while we're on the part of the team that focuses on disseminating these tools, it's important that we have the tools to disseminate in the first place. Here are the current core members of the apps development team to develop these tools. Others have and continue to contribute to these tools, but this is the current development team. Next slide. First, let's consider why we care about spreading the word on mobile mental health apps. Slide. People tend to have smartphones. 89% of service members own a smartphone. These tools can be accessed anytime. Most of us could use a little help now and then. And other than emergency services, most services are not available at 1 in the morning, for instance, or at random times throughout the day and night. Apps are discreet, and discretion is particularly important among veterans who continue to name stigma as a barrier to seeking treatment. Next slide. These tools can help reduce gaps in care. Of the total veteran population, many have mental health needs. Fewer of those who have needs are screened. Of those, not all receive mental health treatment. And of those who do receive treatment, people often continue to actually meet criteria for a diagnosis or have residual symptoms. Mobile apps have the potential to reduce gaps in care and to fill gaps at multiple points along the continuum of care. One way we can fill gaps is through other members of the care team. So this is some examples here: primary care, chaplains, peer specialists, and so on. And some people might be more comfortable talking to a non-mental health specialist first. That might be the foot in the door that leads them to engaging in care. And if not, at least they have potentially tools in their pocket to inform future care, or maybe if they're subacute, maybe meet some of their needs now and not actually have to engage in care. Apps can also be important for multiple populations, to include women veterans who report barriers to care at the VA setting, which it has been historically developed and primarily focused and designed around male veterans. But it's important to note here, we'll mention multiple times today, that apps do not replace treatment. Next slide. Multiple ways these apps can support care. Many people, psychoeducation is a common part of treatment, and that could include handing people a flyer to read later on their own. And that requires one to have those flyers available, and which is difficult in telehealth, but also if you're floating around offices, you don't have time to print things out, it's good to have these tools available. They're accessible, they're in their pocket. I could fold up a binder worth of information, or I could try to carry it around with me, or I could have that equivalent amount of information stored in my pocket in a mobile device. They support evidence-based psychotherapies. We'll talk about that later today. You could track symptoms over time to see what's changing, what isn't changing, and maintain gain. So part of discharge planning or end of an episode of care, you want to maintain the tools you've learned or be able to track when I might want to come back to treatment, and keep skills in my pocket so I can maintain those with the app. And of course, over telehealth, where I can't hand a flyer through the screen, I can have somebody looking at their device on the other side of the screen, and we can look at that together. Next slide. Our VA mobile mental health apps are broken down into two primary categories: self-care apps and treatment companion apps. And you'll see some of the icons here. And self-care apps are meant to be used by anybody, whether or not they're engaged in care. They could supplement care. They don't replace treatment, but they could be used. Someone might just go to the store and download and be interested and look up this information on their own. And then maybe that results in them coming into treatment. treatment companion apps are meant to supplement the evidence-based psychotherapies, and we'll talk about exactly some of the features that support those treatments later today. Next slide. These are free. It's paid for by your taxpayer dollars. People can find them in the app marketplaces now. All of these are on iOS, most are on Android. They don't share personal health information. And for people who might not trust the government or not trust technology because so much information is shared nowadays, that could be a huge selling point. They're Section 508 compliant, making it easier for all people to utilize the app. So a logical sequence, clear contrast on the screen, and be able to work with augmenting devices or programs for people who have visual impairment, hearing impairment, and so on. So they meet minimum standards outlined there by the government. They're evidence informed. And while they're focused on veterans and people who work with veterans, these can be used by anyone. Next slide. The VA also offers some online programs. These have many of the same benefits of apps, but can be accessed by anyone where they might have challenges with a mobile device. And but these require a continuous connection to the internet, unlike the apps, which once downloaded mostly function independent of the internet with the exception of a few features. But the online programs require constant internet connection. And the apps and the online programs do not communicate with each other, even though they have many similar features. Because they're connected to the internet, they might have some added features like more interactive content and videos, so more information can be downloaded. And maybe people don't have a mobile device, or it's difficult with their hands to use a mobile device. They prefer to use a computer, or maybe they have one in their home or at a local community setting. They can utilize these tools in that case. Next slide. I'm going to pass over to Colleen to cover some of this content now.
Thanks, Tim. All right, so when talking about some of the evidence support for VA mobile mental health apps, I think it's important to offer some context, which is that, when it comes to researching the actual apps themselves, we're kind of still in the early stages of that. And part of that is just because it's difficult sometimes for research to keep up with the technology, right? In the time it takes to complete an RCT, an app maybe has been through a couple different builds, and so it can be challenging in that way. And at the same time, apps released by the National Center for PTSD do have some of the strongest evidence behind them. What we do know is that VA apps are generally acceptable to patients and providers, right? So that's kind of the bar we were trying to meet. I think they may be preferable to some, but that's not what we were looking at in that study. We also know that patients who used PTSD Coach showed more improvement compared to those on a wait list when we compared the two conditions. We also know that veterans who use PTSD Coach with the support of a clinician were more likely to accept a mental health referral later on than the folks who use the app on their own. So when possible, it is recommended that folks use these apps with a little help, but it's not always necessary. So now what I'm going to do is talk a little bit about our self-care apps. As Tim mentioned before, majority of our apps are those that are meant to be used by veterans to manage symptoms on their own, but of course can be used as part of treatment. These are our self-care apps that are currently available. The first we have is PTSD Coach, which is for those who've experienced trauma and would like to learn coping skills, track their symptoms, and complete some readings on PTSD. We also have PTSD Family Coach, which is for those partners, family members, or loved ones of individuals who may be experiencing PTSD. This is a great resource to recommend for those folks who are wanting to learn not only how they can cope with the challenges of being close to someone who has PTSD, but also how they can support their loved one. We also have AIMS for anger management for anyone experiencing problematic anger. This app contains helpful things like anger logs and creating an anger control plan. We also have Couple Coach for partners who want to improve their relationship. And COVID Coach, which we'll be talking about more today, is for help managing stress related to the COVID-19 pandemic. Insomnia Coach is another great one that I really like and recommend to my patients. It's designed to help improve sleep for those experiencing some insomnia, as so many are during COVID, unfortunately. We also have Mindfulness Coach, which is designed to help people develop and maintain their mindfulness skills. And Vet Change for anyone who is concerned about their drinking and would like to cut back or quit. The vet change, if you've seen it before, we should let you know that vet change, actually the new build was very recently released in the last few weeks. So if you had the app previously and you haven't had a chance to look at the new build, I encourage you to go to the App Store and you have to re-download it. So if you already had vet change, it will not automatically update to the new build. So go back to the App Store or Google Play, search for vet change, and you can see the new build there. Our self-care apps do share some common features. So they all were meant to address a specific concern, but they do share some common components. And those components would be firstly, psychoeducation. So they all contain educational readings about mental health and wellness. They all contain coping tools. They also offer symptom tracking. Obviously, our apps can't diagnose. You need to see a professional to be diagnosed, but they do allow tracking of symptoms over time. Our apps also offer crisis resources. So at a very minimum, all of our apps link to the Veterans Crisis Line, but many of our apps have expanded crisis resources depending on the focus of the app. And our apps all allow some form of customization. So at a minimum, they're able to favorite certain tools in the app to allow for easier access. But a lot of our apps come with much more customization features, and you'll see a few of those when we look at COVID Coach. Which brings me to COVID Coach. I am going to actually pull up the home screen so you can check it out. But before we kind of dive into the app, I do just want to provide a little bit of an introduction. For those of you who haven't had a chance to download, I do encourage you to use the QR code on the screen so that you can follow along with me as we go through the different features of the app. But COVID Coach was designed to help folks manage stress that they were experiencing related to the COVID-19 pandemic. And the idea was that people who downloaded the app would be able to learn ways to improve their well-being during the pandemic, use trackers for mental health and personal goals, find tools for coping and self-care, and follow links to additional resources if they found that they needed them. I do have a testimonial here that I want to share. I think that we pulled this from the App Store, but I think it shows a nice kind of use case for the app. So this user said that they love the app. It helps me track my goals for me and my family so that I can remain focused on the present. These are hard times, and this app helps me do a little bit each day to hold on to my sanity. Now, I wanted to highlight this testimonial in particular because not only did it show how the user is using the app, so tracking personal goals, staying focused on the present, but it also kind of highlights the fact that it only takes a little bit of self-care each day to make a world of difference. And we really hope that the app can be helpful for that. And for those who may be struggling to kind of get started, not knowing quite what to do with the app once they download it, our team has also created a 30-day guide called 30 Days of Self-Care with COVID Coach. It presents 30 different self-care practices. The idea being that you do one activity for each day of the month, but can be used kind of however the person wants to. This guide can be found at www.myvaapps.com/press kit. And actually, Tim, if you wouldn't mind putting that link in the chat so folks can have access to that too. You can find the 30-day guide to download there. Okay, and with that, I'm actually going to switch over and I'm going to share my screen so we can go through the app itself. Okay. So keep in mind as I'm going through, what I'm using here is a program called BlueStacks. I'm not actually mirroring my device. I'm using this computer. It's a software that emulates an Android device. And so there will be certain features that I actually can't show you, but we can show you a majority of them, and I'll let you know when there are things that we can't move forward on. Okay, so what you're looking at now is the home screen of COVID Coach. As you can see, there are kind of 4 main areas of the app that you can explore, and we'll go through each one. I like to start with Learn. So if you go on the top right quadrant there, you'll see the Learn section. I'm going to tap on that now. And you can see here we have a variety of different reading topics kind of grouped around a similar theme. We have first Staying Well, which contains suggestions for healthy coping. We also have Staying Balanced, which is reading about kind of self-care and self-compassion. We have Staying Together, which provides kind of relationship tips and tools, as well as Stay Safe for those who may be at a higher risk of violence during the pandemic. And then we also have Staying Healthy. So all of those questions about protecting yourself from COVID-19 can be answered in this section. I want to highlight one section in particular with this group. So I'm going to click on Staying Balanced. You see here, we actually have a special section for healthcare workers, where we identify some of the concerns that are specific to healthcare workers. So this is a really great resource to check out for yourselves, but also for colleagues. All right, I'm going to back out now. All right, now we're going to go back to the home screen. The next section I want to point out to you is manage stress. So if you go to the sun icon there on the top left, go to manage stress. This is where the user is going to find all of those coping tools. And when selecting a tool to try, they have a couple options. So the first thing I can do is if I navigate to challenges, you see I can browse tools that are suggested to me based on whatever I'm struggling with in the moment. So for instance, if I'm feeling, maybe I'm feeling sad or hopeless, if I tap on that, I'll be presented with a tool. So in this case, I was presented with worry time. And now I'm going to go back. The other option I have is just to browse the full list of tools and pick the one that sounds the most appealing to me in the moment. So I went over and toggled to tools, and you can see we have the full list right here. So let's say I'm going to click on, let's do positive imagery. There's a few different options here. The user has the option to walk through an exercise at the beach, country road, or forest. But let's say I ended up really liking this tool. What I would suggest to that user is that they're going to click the thumbs up icon on the bottom there. So if I click that, it now is dark green. And now if I navigate back and I go to my favorites list, it appears here. See positive imagery. I also want to point out, so not only does it appear here on the favorites list, if you go to the home screen, it also appears on your favorites bar at the bottom there, and you can add as many as you'd like. All right, I'm going to show you one more thing in manage stress before we move on. So if I click on manage stress, the other option I have, I'll click on tools, is I can add a tool. I can create my own custom tool, which is, I think, a pretty cool feature, especially for providers who are working with folks that are using the app. So if you have an iPhone, where you're going to click is at the top of the screen. You'll see a create your own tool. I have an Android here, so I'm going to click on that plus sign on the bottom right. And here I can create my own tool. So I can type the name and then the tool type. So I can do text, where I can just type out some text. I can do voice memo, so just record a memo. I can also import music, personal photos, or videos. I think this is what I really like to highlight to providers is this is a really great opportunity. If you click on memo here, you can even record a voice memo and a coping skill in session with the patient, just have them open up their app, hit record, and you can walk through the exercise with them, and then they can save it for all time, which is really nice. Go back. Okay, so that's manage stress. I'm going to go home. Now, the next section I want to take you to is mood check. So if I click on mood check on the bottom left there, I have a few options here. So the first option in mood check is I can set a personal goal. This is where users can kind of create those custom goals if they're having a hard time maintaining momentum for a personal goal, or if it's just a self-care goal. What I would do here is click get started. And we're going to just walk through what it would look like to do that. So I know for me, I'm having a hard time motivating myself to get out of the house, to walk every day. So that's going to be my goal, walk 20 minutes a day. Then I'm going to hit next. And then it's going to ask me to rate how successful I've been on a scale of 0 to 100% in meeting that goal today. And I was good today. So I'm going to go to 100 and I'm going to submit it. So now when I go to goals, it will be listed here. And I can go back and check in each day and say kind of how successful I was in meeting that goal. And I can view my progress over time by tapping on the graph icon on the top right. And you can see that then, it doesn't have any entries at the moment, but over time this will fill out and you can track your progress. All right, now I'm going to navigate back. And then actually you can see here I can add a new goal if I want to track multiple goals over time. All right, I'm going to go back. You have a few other options here when tracking well-being and symptoms. So the first one here is you can track well-being with the Warwick-Edinburgh mental well-being scale. We also have a number of other symptom measures and mood checks. So we can you can track anxiety with the G87, track mood with the PHQ-9. You can also track PTSD symptoms with the PCL-5. So lots of options for tracking mental health and well-being in COVID Coach. I think the most of any app that we have. The other thing I want to point out to you is if you'd like to share the scores on any of these items with another person. So for example, if this is a patient working with a provider, they can share their scores with their provider by clicking on this export icon on the top right. So I click on there. So if it's saying I can export my mood check data now. It's going to ask me what I want to export. So maybe I don't want to export everything. I'm just going to export my G87 and my PHQ-9. So I toggled those are toggled to the right, and now I'm going to tap export data. I'm going to get this pop-up message that says, just FYI, you're sending data out of the app. That's what you're trying to do with this. So you would say yes. And then this is one of those places where I can't go to the next step with you. But if you click yes and go to the next step, you're going to be given any number of options depending on the device you have. So at a bare minimum, you'll be given the option to email yourself a copy or email the copy of your scores out to someone. You may also be given the option to save a copy of the data on your device or to Google Drive or Dropbox. So there's a few options there. And what it will look like is a CSV file. All right, I'm gonna navigate back now. So that's mood check. And then the last main feature of the COVID Coach app is find resources. So COVID Coach really does come with a very comprehensive list of resources. It does have the crisis support resources of all of our other apps, but it also contains resources for meeting basic needs like food and shelter, and also resources for kind of staying up to date on COVID-19. So it's a really comprehensive list here, and also has resources for finding professional help for those folks who haven't made that connection yet. Okay, so we're gonna go back to the main screen, and a couple other features I wanna show you in the settings and just kind of the extra features. So the first is the app also allows you to set reminders. So if you see that clock icon on the top right, I'm gonna click on that now. You have the option of setting a bunch of different reminders. So first one is you can opt into being sent a push notification with a daily inspiring quote. You can also set a reminder to try a new stress management tool. You can also set a reminder to check in with your goals and track any of your well-being or any of your symptoms. So tons of different options for reminders here, which I think is really important when folks are struggling with just motivation to have that extra boost or reminder to check in with yourself or meet your goals. Okay, I'm gonna navigate back. And now we're gonna go to the lateral menu, which is those 3 bars on the top left of your screen. The first thing I wanna show you here is there's some options for personalizing the app. So if I go to Personalize, I can do a few things. I can upload or import some personal support contacts to have easy access to them if I want to remember who I can, reach out to if I'm having a hard time. I also can import personal photos or songs. Once these are imported into the app, these songs and pictures are used to populate some of the coping skills in the app, like the soothing images and soothing songs. The other thing I can do here is change the language. So I should have mentioned this earlier. I think COVID Coach is actually available in Spanish. It's the same app, you would just change the language. So if I go here, you see I tap on English and I'm given the option to change it to Spanish. What will happen is that the app will then reset in Spanish. All right, lateral menu again. The last thing I want to show you is manage data. So if you go to manage data, you can do a few things here. So you can export. So this is another area of the app where you can export your data. You can also delete your data here. And here you can also opt out of providing anonymous usage data. And what that means is that, while our app doesn't share any collect or share identifiable data with the VA or any third parties, we do collect some anonymous data that helps us to know, maybe what parts of the app were being used when the app crashed, and some other things like that are completely anonymous. But if the user doesn't feel comfortable with that, they can opt out. So that's an option. Okay, so that's COVID Coach. Really briefly, with COVID Coach is going to be our focus today, but I also just want to quickly highlight for you a PTSD coach, just so you can see what it looks like. Feel free to download it if you want to check it out. I'm going to toggle over to that. As you can see, these apps are very similar, and we kind of wanted to show you this just so you can see just how similar they were. The reason for that is that COVID Coach was actually kind of built using the PTSD Coach format. That's how we were able to get it out so quickly at the beginning of the pandemic, was just using some of the building blocks of an existing app. So you see PTSD Coach is the same core features. They're called something different. We have manage symptoms, track progress, get support, and learn. But of course, this app is going to be geared towards folks with PTSD. So we'll contain more, the learn topics, for instance, are all about PTSD. And the the coping skills are geared towards different symptoms of PTSD. The one thing that's different that I did want to point out is PTSD Coach now contains a suicide safety plan app module. So for those of you working with folks who are experiencing suicidality, this is a really great feature where they can input their suicide safety plan directly into an app and then have access to it at all times when they have their device. So if I'm going to skip this intro here. So you can see this is the safety plan screen. Oops, did not mean to do that. And if I go to my safety plan, I will be given the option to input data into all of these steps. Now, to give you a bit of an overview of what it's like to use Safety Plan, we're going to show you a video so you can see a little bit more about that on your own. Let me just switch over to that. Okay. All right, enjoy.
If you have experienced suicidal thoughts or urges, the Safety Plan is an important tool that you can use to keep yourself safe. When you're in crisis, it can be difficult to think clearly. A safety plan is an emergency action plan that you can use until suicidal thoughts or urges to hurt yourself pass. This tool will help you create a plan to recognize when you're heading toward a crisis and to identify coping strategies you can use before and during the crisis to help keep yourself safe. The safety plan is part of the PTSD Coach app. You can access the safety plan from the app menu. Make sure you favorite the safety plan by tapping the thumbs up icon. This will add your safety plan to the home screen of the app so you can access it quickly and easily in the future. Ideally, you and your healthcare provider will create your safety plan together. You can also complete the safety plan on your own. Throughout the app, you'll see an information icon in the top right corner. Tap the icon to get more details, tips, and examples for completing and using the safety plan. If you need additional help completing your plan, call the National Suicide Prevention Lifeline or the Veterans Crisis Line, and a trained crisis responder can help walk you through the steps. You should create your plan when you're not actively in crisis. Let's walk through the steps for completing a safety plan. The first step is to add a list of specific warning signs that you experience when you get distressed. These warning signs let you know that you may be experiencing or on your way to experiencing a crisis. You can select items in the provided list or write in your own signs. When you notice that you're experiencing these signs, you can use your safety plan to help manage the situation and prevent things from getting worse. In step 2, you will add a list of realistic activities that you can do by yourself to distract yourself when you're experiencing suicidal urges. Distracting yourself helps you to not think about your problems for a short time, giving you time to let thoughts of hurting yourself pass. List as many specific things you can think of, including things that have helped you stay safe in the past. You can also select items from the provided list or add tools from PTSD Coach that you have found helpful. In step 3, you will create a list of people you can contact and places that you can go for a healthy distraction until the crisis passes. Add social contacts, such as friends or acquaintances that you can reach out to for a distraction. Note that when the app asks for access to your contacts, it only pulls in the specific contacts that you select, and that information stays on your device. No one else will have access to it. To remove a contact, swipe the name to the left and then tap Remove. When listing places, be sure they are specific, safe places that are easy to get to and that you have been to before. Consider places that are open 24/7 so that you have somewhere to go at any time of day. In step 4, you'll add a list of family members or friends that you can contact for support. While step 3 includes any social contacts that can serve as a distraction, the friends or family members listed in step 4 should be people that can support you in a time of crisis. It's also a good idea to share your safety plan with the people you list here so that they know how best to support you when you reach out to them. In step 5, you'll list medical or mental health professionals that you can contact in a time of crisis. These should be professionals that are already known to you rather than professionals that you haven't contacted yet. It can also be helpful to include the phone number and address for the local emergency room or urgent care. This section also includes links to emergency resources. The final step in your safety plan is creating a list of ways to make your environment safer. The goal is to increase the time and distance between a suicidal impulse and an object that you might use to hurt yourself. You can select items in the provided list or write in your own. If you have thought about a method or made a plan for suicide in the past, consider the specific things you can do to make it harder to access the items that may have been part of that plan. You don't have to consider all of the suggestions in the app. Choose the things that are relevant for you. Add friends or family members who can help you keep your environment safe. Once you've completed your safety plan, review the entire plan by swiping from one step to the next. Use your plan whenever you think it might be helpful, starting at step 1. If the crisis subsides after following a step, you don't have to go any farther. If one step is not helpful, go to the next step. You can also skip steps if you think you're in immediate danger, going directly to step 5, for example, and seeking professional help. It's a good idea to export a copy of your safety plan so you can share it with loved ones, especially the people you added in step 4. You can also consider sharing it with your healthcare provider by attaching it to a secure message. If you're in crisis, you can quickly get help in the Get Support Now section. If you're not sure of what happens when you contact a crisis line, you can learn more in the Safety Plan Help section. You should review and update your plan regularly so you are familiar with each step and can recognize when you are headed toward a crisis and use your plan. You can set a reminder to review your safety plan on a daily, weekly, or monthly basis. You should also review your plan after a crisis to assess how it helped. You can keep the things that worked well for you and change anything that didn't work as well. The safety plan is part of the free PTSD Coach app. Download it today and create your own safety plan to keep yourself safe the next time you're in crisis.
All right. Hopefully that gave you an overview of the safety plan. I also just want to note that obviously that was a patient-facing video. We have a number of YouTube videos that review the main features of all of our apps, and that's just one of them. So that's a great way to kind of introduce an app to a patient if you don't have a ton of time to go over it in session. I'm going to share my screen again. Okay. I also just want to add a couple more things about the safety plan app itself. So some things that are not included in the video that I think are of interest more to the providers. We do just want to mention that, the safety plan app module is based on the VA safety planning intervention manual. It did have input from the creators of the manual, Drs. Barbara Stanley and Greg Brown, also the Office of Mental Health and Suicide Prevention, and other suicide prevention stakeholders throughout VA. And as with our other apps, it's compliant with VA privacy rules in Section 508. So yeah, the intention with this app was really just to offer veterans more choices in how they kind of hold and keep their safety plan. Not necessarily intended to replace the paper plan, but definitely can be used if that's the veteran's preference. And with that, I will turn it back over to Tim.
Thank you, Colleen. We'll now talk about what's available with the treatment companion apps in a brief overview. Next slide, please. Treatment companion apps contents were chosen to complement 6 of the evidence-based psychotherapies currently being rolled out at the VA. You can see that 3 of these apps are undergoing redesigns, and we hope to have new versions released in the next year or 2. So we have ACT Coach for acceptance and commitment therapy, CBTI Coach for cognitive behavioral therapy for insomnia, cognitive processing therapy, CPT Coach, prolonged exposure, PE Coach, Stay Quick Coach to maintain gains in tobacco cessation, and Stare Coach for skills training and affective and interpersonal regulation. These apps are recommended for people engaged in the given treatment, as much of the content won't make sense without a trained professional guiding the person through it. However, we heard of people using some of the apps, especially CBTI Coach and Stare Coach, independently, and that's fine. It's worth noting that we have Insomnia Coach, as you saw earlier, which is designed for self-care. So you may recommend using that one versus CBTI Coach, unless you're actually a trained CBTI provider. Next slide, please. Treatment companion apps have many of the same benefits of the self-help apps with some added features. These include worksheets, measures, and information used in specific evidence-based psychotherapies. A patient and provider might choose to use these, especially in situations where it's difficult to print or carry around hard copies, such as over telehealth or in an office where you don't have time or resources to print, store, and organize handouts for therapy. You can put in your provider's name and contact information in the app, put in at the end of one session, schedule when the next session is so they know where to find it all the time. And some of them walk stepwise in sequence through the homework and content for the modules. You could sort of use it as a backbone to structure in session and between session work in the therapy. Next slide, please. Now that you've become acquainted with a couple of our apps, we're going to discuss how to incorporate apps into the care that you provide. Next slide. As providers, we have some ethical obligations in regard to apps as we would when we offer any intervention. At a minimum, we need to know and be trained in the intervention, be familiar with the content, and know any risks or benefits associated with that intervention. There are a number of other ethical considerations when it comes to apps. We've listed here some of the principles as outlined in the APA Ethical Principles and Code of Conduct, as well as ways these principles may apply to apps and online programs. We've chosen to highlight the APA principles and standards because obviously Division 18. These principles, however, apply to multiple specialties, and we've reviewed other ethics codes, and you'll find that there's a significant overlap between what these suggest and other professions. But if you do have another licensure profession, I encourage you to review the ethics principles for your designated body. Let's review in detail a little bit, starting with the principle of beneficence and non-maleficence. It's important that we don't make false claims about the effectiveness of apps. As you heard from Colleen, evidence regarding apps is positive but limited at this time, so it's important to be clear about that. It's also important to note that apps do not replace treatment. And we do not ask patients to download any apps that may pose a risk to their privacy or security. Likely it's not come as a surprise that some of the apps in the marketplace sell data to third parties. And it's your duty to know privacy and security policy of the apps that you're recommending. The principle of responsibility. It's your responsibility to evaluate any tools that you recommend, and that includes digital tools. Some information to consider is the privacy policy and the evidence base, but also ease of use and appropriateness for your intended purpose. Good news about VA apps, the mobile mental health apps, is that you know the developers and you know the basic functionality of our apps and our privacy policy. It's stated in plain English. This may be harder to find with outside apps. The American Psychiatric Association has created guidelines for app evaluation, and you can find out more about these and a model they recommend for the evaluation on their website. The other APA, that is. Principle of justice refers to equal access to quality treatment that meets each patient's needs. These can also be extended to equal access to digital resources. People are already talking in the chat about different demographic groups. Regardless of the patient's device or operating system, some apps may not be available to some patients depending on their operating system, iOS or Android, or even Windows. The other platforms out there as well. So it's important to know which they can have access to, and if they don't have the platform that you're interested in, you might have an alternative on standby that could meet your needs. Then ethical standards of competency, which states that counselors should receive appropriate education and training prior to practicing in specialty areas new to them. Guidelines pertaining to apps is becoming, are increasing, but they aren't established at this time. So it's becoming a specialty area, the use of apps in care. and requires at least some additional training. Good news is you're on your way of meeting that today. Next slide. Now that we review some of the ethical considerations, let's talk about what this might look like in practice when introducing an app in a clinical encounter. When utilizing apps as part of an encounter, you should consider the following. We talked about, and you'll notice there's some repetition today, driving home some key points. Learn the tool we're talking about. You're not expected to be an expert in every app, but you should know some of the basic features and resources available. And for technical questions around the apps, and we'll mention this a few more times today, you can email us at mobilementalhealth@va.gov. If you're recommending a non-VA app, it might take more time or research to answer some of these questions, so account for that. So now you have someone in front of you who are going to be talking about a tool. You want to assess appropriateness. Do they have the right device? You might consider utilizing the mobile device proficiency questionnaire during your first meeting as to any skill gaps you might need to address in your time together. And the next few steps might happen simultaneously. Demonstrate the functionality and obtaining informed consent and addressing any questions, particularly about security and privacy. This might be as simple as no information that I can identify you personally is ever shared by these VA mobile mental health apps, and that includes the VA itself and any other parties. Then demonstrate the device. So to the best of your ability, have the user drive. So that makes sense in telehealth. You can't have them on your device if they're on the other end of telehealth. So you ask them to download it, utilize it on their end. But even if you're in the room with them and you're utilizing a clinic device or maybe even your personal device, have them get their hands on that tactile reinforcement, that motor memory might improve their ability to get back and use it in between session. If you are utilizing your own device, well, theirs you want on at least do not disturb, but on yours, probably put it in airplane mode so that you don't get any personal texts or business emails during the time that they're on the device looking at it. Give yourself time to do this. It's not just a matter of handing a flyer, here's an app. That's the minimum, sure, if that's all you have time for, but you might want to take up to 15 minutes discussing the actual functionality, getting people into use the app the first time. That could demonstrate to them this is important. This isn't just a haphazard or just something I thought about off the top of my head, that we're spending time on this, which means it's meaningful. And that might increase adoption outside of your time together. We'll talk about informed consent more in a moment. And then assigning homework. Be specific. What is the tool you're going to recommend? And then what is the feature in that tool so that so they're not getting out like, oh, this is an app. I can look through all these different tools and resources, not exactly sure what might be most useful. So be specific in that recommendation. I could review each of these separately with a little bit more detail. Next slide, please. Learn the app. And remember, this is an offering, a recommendation. So you might say something like, would you be interested in learning more about an app that could help you manage your symptoms? The answer might be no. And in response to that, you could gently inquire what gets in the way, because the barriers are often fairly easily overcome with a little bit of information. So address any of those barriers that are addressable in the moment. And if not, maybe the tool isn't right for them, and that's okay. And point out that these tools do not replace treatment. Next slide. Demonstrate a few features. Offer what's best for them on their device or yours. And again, airplane mode. Next slide. Key points of informed consent. These do not replace treatment. Evidence is positive and limited this time. Risks, benefits, and limitations. And you might have this conversation with them, ask them what their concerns are. We commonly hear privacy is the concern, so we harp on that a lot as to how to address that. But there might be other factors that you hadn't considered. And review the benefits. So more portable, I don't have to remember my sheets because it's on my device. People tend to remember their phone. It might be more convenient than do it using paper. Some people, it improves their experience by utilizing the devices. And maybe you could identify some other benefits we haven't listed here. But there's also some limitations. So, pardon me, if I lose my device, I lose my information. Because this information isn't backed up, it doesn't go to the VA or somewhere else, So that's a feature for privacy reasons, but it also means if I lose it, I lose my data. And also, because no information is shared, personal health information is shared, providers won't be accessing this to know what the person is experiencing unless they decide to export where that is available in the app or to bring it into session and talk about it. So pointing out that if they need crisis resources, they need to reach out to those crisis resources. Nobody's going to follow up based on what they enter in the app, in these particular apps. Next slide. Colleen showed us how to manage data as to some options there. And the default is to share anonymous usage data. This helps address bugs and improve the app and understand how the apps are used in general, but no personal health information is identifiable. All we know is that somebody in the United States downloaded this app, or whatever country it was or region in the world, but we don't know who that individual is and can't identify them. And they could even opt out of the anonymous usage data, as you saw today. And protect one's phone. So phones are great in that you can password protect, but if the grandkids or kids have access to the key code or your spouse, then they can get into the devices. One of the apps, PE Coach, has the option to add an additional code in the app itself so that people aren't going to stumble onto the contents, for instance, recordings of trauma counseling in that app. But otherwise, people have to protect their phone if they want to protect the contents of their phone. Next slide. Make a recommendation. Here's a behavioral prescription pad. These are available from the government printing office. People tend to like this to have it on the desk. It's kind of attractive and interesting. And electronic versions of these are also available if you want to check them off and send them electronically. But be specific if you can. So you might say use this. Use the body scan tool in PTSD Coach. But if it's a shorter encounter and you don't know exactly what they might find use from, you could be a more broad. Just say, hey, check out PTSD Coach, and then check the app at the top of the list that you think might be useful for them. Next slide. And then in the end, you can go ahead and advance all these things. Document. Now, of course, for your own records, but also to communicate to other providers if you're using electronic health record. And this communicates to others whether or not how familiar somebody is with an app, maybe help follow up with them. Hey, are you utilizing this tool if they're meeting with another provider? And being specific, you want to share what was recommended, how you thought it might be useful, and what the patient's response was. They said they'd check it out and it can discuss in future sessions and come back with any questions. So document at the end of going through all those steps that you've gone through above. Next slide. We've covered a lot of information today. We've entered some questions in the chat, and we'll take a few minutes now to try to wrap up any other questions we haven't answered. For technical questions, please reach out to mobilementalhealth@va.gov if there's technical questions about these apps, and somebody was already asking about research and types of data that might be available. So if you're interested in doing research on apps, we'd like to hear about it, and there might be features to support you in doing that. And links to our videos. So you learned about the YouTube videos today, you saw an example. You can go to the NCPTSD webpage here, the AppFid mobile, and find links and flyers for downloading these resources that can be useful for patients or providers to understand the tools better. For those internal to the VA, I understand some people in the audience are today, you could check the Tech into Care website or SharePoint site internally. Short URL is there. Please sign up if you're interested in this type of information and in using apps in care. The practice-based implementation network CE lecture series. Prior recordings are available at this link here. In the chat earlier, you saw myvaapps.com. You can go through there and look under, follow the links to get to the PBI network, see prior recordings, or sign up to receive information for future presentations. Mentioned some of the posters you saw today and the prescription pad are available at the government printing office, link there, and more information on privacy on the VA blog, publicly facing. Next slide. Mentioned the lecture series. The next one coming up is March 10th. We have people internal and external to the VA with different areas of interest with the use of technology in care. So we have Halane Wabe, Mindfulness at Home, exploring outcomes of the internet, mindfulness meditation intervention, and the iMinder smartphone app. So please join us for that if you're interested. Next slide. Again, mobile mental health at va.gov. And I'm going to go into Q&A here. And I see, is there any more data on switching between multiple apps? So depending, Laura put the example, anger management, PTSD, and substance use, someone might be using or interested in utilizing apps in all of these. I can't speak to that off the top of my head. Colleen, please speak up if you can, as to whether or not there's any issues with switching back and forth.
I don't think so. I would just say, you know, I would avoid recommending too many and having them sort through. Just I think it can be overwhelming. And so, you know, I would just say use your best clinical judgment based on, you know, which features of the app you think are going to be most helpful to that veteran, and kind of maybe start with one or two and go from there. There is a lot of overlap. So, you know, for example, Vet Change does include a lot of information about PTSD and its contributions to substance abuse, as does AIMS for anger management. And so, you know, oftentimes, you know, if PTSD is the comorbid condition, there's a lot of info there. But I would just, you know, familiarize yourself with the apps and figure out what you think is going to be most appropriate for the patient.
Yeah, great point, Colleen. And keep in mind, if you're utilizing these in care, think about what you would normally do. And then this is one way of conveniently delivering that same information. So you maybe just use certain modules or certain components of an app because it fits with how you engage in care and what you already do.
I think that's the end of our questions.
Those were you guys did a great job going through. Oh, somebody just posted one right when I was going to say we got through all of the posted Q&A. Do some of the apps come pre-installed on the VA issued iPads?
We are attempting to address this at the national level. Individual sites might have this depending on who manages the devices. So not consistently at this time, but there is the VA Launchpad, and the Veteran Launchpad in particular has all of the mobile mental health apps. And also like to point out that we're talking about the mobile mental health apps, and there's a broader suite of apps in the VA, somewhere called connected apps, and those do share information. So what we talked about today were specifically the mobile mental health apps.
All right, Tim, I'm going to have to let that be the last word. Again, for those of you who are interested in your continuing education credit, you will be receiving an email automatically at the end of this webinar, and it will have a link to a survey, which after you complete that, your CEU will be emailed to you by our CEU coordinator. And just have to say, I knew this was going to be a fabulous presentation and you did not disappoint. Just amazing information, and really appreciate the walkthrough COVID coach so folks could actually see the functionality. Thanks for all you're doing at the National Center for PTSD. These apps, though, to be clear, are not just for veterans, but can really be utilized widely by providers and non-veterans alike. So thank you all for everything that you're doing. Thanks for those who attended, and we'll see you at the next webinar. Thanks, everyone. Bye-bye.
Thank you very much.
Thank you for having us.